Good evening and welcome, everyone. Thank you for joining this live telephone town hall with Congressman David Scott. My name is Dirk, and I'll be moderating this call. Tonight, we're looking forward to an informative discussion. Now, in a moment, I'll introduce the Congressman so he can provide his opening remarks. Then, we'll hear from our panel of medical experts and public health officials. After we've heard from the experts on the call, we'll have time for questions and answers. If you have a question, please press *3 on your telephone keypad. You'll be placed in line to speak with a member of our staff. They'll take down your name, where you're calling from, and the question you would like answered during this call. Again, if you have a question you want asked, please press *3 on your telephone keypad to enter the question queue. Now, if you would like to stay in touch with the latest happenings, please press *6 to join the Congressman's e-newsletter. Again, *6 will allow you to join the Congressman's e-newsletter. And now, it's my pleasure to introduce Congressman David Scott. Representative, the floor is yours, sir.
Thank you so much, Dirk. I really appreciate that. Welcome, everyone. I want to thank Lido's telephone town hall platform for putting this together. It's very important. And I'm so excited and thankful to have our distinguished panelists who can provide the critical information that our constituents need. And I want to thank my staff and Chandra Harris, all our team down there, and Catherine Kurbis, my team up here in Washington, my chief of staff, for working and coordinating this. And first, let me say thank you to Dr. Colleen Kelly, Associate Professor at the Emory University School of Medicine, and she heads up the Division of Infectious Diseases and is the principal investigator for Moderna's vaccine trial. And then we're very delighted to have Dr. Jeffrey Hines, Medical Director with WellStar's Health Systems Center for Diversity, Inclusion, and Health Equity. And then we have Dr. Jeanette Meamark, our District Health Director for Cobb County and Douglas County Public Health. And also we have Dr. Lynn Paxton, who is the District Health Director for Fulton County's Board of Health. And folks, I want to get off here in a hurry because we have an hour. I want to get as many of your calls in and information. But let me just tell you, I am committed to making sure that this, which is God's blessing, to be able to pull our fantastic, hardworking pharmaceutical industry and our healthcare providers together with this most effective vaccine. And we're going to get it into the arms and vaccinate our people and save lives. We lost too many. And that is my objective. So please ask your questions, get all of that information in, and wherever I can be helpful, please call on me. I want to start this off by everyone having the number of my phone at my office in Cobb County, Douglas County, Henry County, Fayette County, Fulton County, Douglas County, all of our counties. And that number is 770-210-5073. And we also have Dr. Sudha Reddy, my good friend, and she heads up the Emergency Services Physician Office with the Clayton County Fire and Emergency Services. Now, one final thing. Many of you remember we jumped out on front because just like this virus has hit us hard and we had to get folks tested, these were our partners who came forward at Mundy's Mill High School and also at the Greater Faith Cathedral down near Six Flags in Austell and Douglas and Cobb County. And we made sure our people were tested. And that gave us the framework so that we will be able to move out with this similar infrastructure to do drive-through vaccinations. Because what is important, I want you all to know, that it is going to require 2 shots, 1 shot, and then 3 weeks later another. And the good Lord has provided us with this infrastructure, and we were successful in doing it with our COVID drive-through testing, with the food banks coming, giving free food, and we want to be able to duplicate that success. And it's so important because people will know where they can come back and 3 weeks later and get that second shot. It's got to be 2 shots to be effective. Now, with that, I'm going to slip away and turn it over back to you, Dirk, and let us hear from our outstanding panelists and all of our great constituents. Thank you.
Thank you very much, Congressman. And as you mentioned, it's time to meet our distinguished panel. And we'll start with Dr. Colleen Kelly. Doctor, welcome to the call.
Thank you so much. I was involved, I had the privilege of being involved in leading the Moderna vaccine trial, COVID vaccine trial at Grady Hospital. I'm an Emory professor, and it was affiliation between Emory and Grady, where I was able to lead a site for that trial. Emory had 3 sites, and I led one of them. And I've also, I have the privilege of leading the site for the Novavax vaccine trial, which has just opened. Of course, we heard the amazing news back in November that both the Moderna and the Pfizer vaccines, which are messenger RNA vaccines, were 95% effective. This was just stunning. It was the most amazing news we all could have heard. We never expected to see efficacy to this degree, and so this really has given us hope for the end of the COVID pandemic, which so many of us have been suffering through this last year. And so vaccines really they ignited that light at the end of the tunnel. But now we have to get the vaccines to the people. But a lot of folks have asked me, how did we get here so quickly? How did we get a COVID vaccine in less than a year from when the virus was discovered in December, and then in January, where the genetic sequence of the virus was published? And really what this took was massive amounts, unfathomable amount of resources from the government, from industry, the pharmaceutical industry, as well as academics such as myself. And we're talking about financial resources, billions and billions of dollars, scientific resources, meaning that many of us who had not previously worked on respiratory viruses pivoted to create our teams to focus on coronavirus and, in my case, on clinical trials, as well as personnel. We had to staff up in the midst of a pandemic where everyone else was working from home. We had to reach out and say, folks, we need you to come in. We need you to come and help us do these clinical trials so that we can find an effective vaccine. And this is all under the purview of Operation Warp Speed, which was the multi-agency federal government initiative to get to that vaccine discovered and effective within 1 year. And the way that this happened, in addition to the massive influx of resources, was really product development is traditionally done slowly in sequence. There's phase 1, then phase 2, then phase 3 before it ever gets to market. And so instead of doing things in sequence as is typically done, phases of vaccine development were done simultaneously, such that the phase 1 clinical trial was being done at the same time the phase 3 was being developed, such that it could be launched the minute the phase 1 data showed safety and efficacy. In addition, at the same time these clinical trials were ongoing, mass manufacturing of these vaccines was occurring, such that the minute we had the phase 3 efficacy data, vaccines could be deployed across the country and put into people's arms. This has never been done before. And it is really just an amazing feat of science and really speaks to what can be done with the appropriate resources and know-how to address a public health emergency, which is what we've done. So messenger RNA or mRNA vaccines with both the Moderna and Pfizer vaccines, which received emergency use authorizations from the FDA in December, are new types of vaccines. Messenger RNAs has never been approved before for use, but that doesn't mean they haven't been studied. Scientists have been focusing on messenger RNA vaccines for many years and have been making significant advances and knew that the promise of mRNA vaccines would someday be realized either in a pandemic or in some other setting for treatment of infectious diseases or even things like cancer. Based on the knowledge of other coronaviruses, including the SARS-CoV-1 and MERS coronaviruses that didn't end up becoming global pandemics, but scientists knew that the immune response to the spike protein on the virus was really going to be the key to protection. The spike protein is a lollipop that sticks out on the surface of the virus and kind of covers the entire virus. And scientists knew based on prior research that antibody responses to the spike protein was likely going to be the key. And so a normal vaccine approach would be to formulate the spike protein in the laboratory and then give it to people in the form of a vaccine. And that is the approach that's being taken with other vaccine products such as Novavax and Sufy products. However, it's slow. And creating messenger RNA is actually fairly quick. So messenger RNA is a short genetic sequence. It is not a live virus, but it does just what it says. It gives the message to the cells to make the spike protein. It's reasonably quick and easy to produce large amounts of this messenger RNA, and it's been studied for years. It's not new to the scene, and so people always had hope that messenger RNA vaccines would really change the world, and that is coming to fruition. So the messenger RNA is injected into the body, the muscle cells take it up, and then the muscle cells produce that spike protein. Your immune system then sees that spike protein, and it makes a response to it. And most importantly, it makes a memory response, such that in the future, if you ever do encounter the spike protein on the real coronavirus, your immune system will remember it. And that is the whole point of these messenger RNA vaccines and any vaccines, of course. These vaccines have some short-term side effects after you get them. We call them reactogenicity. And so if you've ever heard of the shingles vaccine, that is also a very reactogenic vaccine. It's a vaccine that has some side effects after you get it. But people know that getting shingles, because they've seen it in their family and their friends, and they may have had it themselves before, it's a terribly painful, horrible illness. And so people are willing to accept a few side effects of the vaccine if it means that it will prevent them from getting shingles later. That's the same thing we're seeing with these COVID vaccines. They do cause a few transient side effects in the first 1 to 2 days after getting the vaccine. You may have a little bit of a sore arm. You may have some redness. You may not feel 100%. You may have some fatigue or some headache. In general, these symptoms are very mild and they go away fairly quickly. And I can guarantee you that knowing that you're protected from the coronavirus is worth some mild side effects.
Dr.
Some
Kelly?
people have also asked me, go ahead.
Thank you very much. I don't want to derail you, but we have a number of other people we'd like to get involved in the call.
Yes, go ahead.
You have a wealth of information, which we're all eager to get, but I bet you we can also get to some of this during the Q&A. So I appreciate your wealth of knowledge and wanting to share it all right now. But let's get the other folks on the call introduced, and then we'll come back around and hopefully have more time to talk about some of the specifics you're talking about right now. So I appreciate your input. And moving on now, we've got Dr. Jeffrey Hines joining us. Doctor, welcome to the call.
Hi, thank you, Dirk, and a special thank you to Congressman Scott. I was asked to speak specifically about some of the issues of equity that are affecting certain communities with respect to coronavirus. Since this pandemic has started in the March-April timeframe, when racial and ethnic data was being released, public health officials have noticed that certain communities, like the African American community and the Hispanic community, were disproportionately being represented among people who came down with infections, who were hospitalized, and who were dying of disease. Now, many people in these communities were considered essential workers and had to go to work. Many members in these communities weren't able to shelter in place. They didn't have that privilege. Many members of these communities lived in multi-generational homes, and we saw sometimes when the infection caught root in a community, it would go through a household. So one of the things that we were tasked to do, and one of the things that we do, is we work with a variety of partners in the district and throughout the state to address some of these issues from a perspective of equity. I'll call out one particular organization that we work with mostly, and that's Cobb Douglas Public Health. We meet regularly with our partners at Cobb Douglas Public Health, and we're able to hotspot areas where infections are flaring up. And that following week, for instance, we're able to deploy a team to go out and do testing. And these testing sites are done on a pop-up basis. They're very flexible. We can accept people who not only can drive up, but can walk up as well, too. As Congressman Scott said earlier, many times we combine this effort with distributing food. But one of the things that's most important right now is our data tells us that members of these communities, the African American and the Hispanic community, are demonstrating a fair amount of hesitancy about getting the vaccine. And if we don't act, the devastation that exists right now will only be heightened and exaggerated. So one of the things that we're doing right now is we are acknowledging that community members do have a hesitancy. We have to acknowledge that. We're listening to why they may have that distrust or that hesitancy, and we're using this information to educate people about the importance of getting the vaccine. Again, if these two communities in particular don't have good uptake of the vaccine, the effects on these communities can be devastating. So specifically what we're doing right now with our partners is we are developing and looking for those trusted voices like Congressman Scott and other people in the community, whether they're faith-based leaders, they're folks from community advocacy groups, but we're finding those trusted voices that can deliver factual, trusted information about the vaccine. We want to educate people. Importantly, we're also, like Congressman Scott said, the infrastructure is there already with respect to testing. How now do we get these vaccines in the arms of people? So we're working with our partners about how to deliver big mass vaccination events, and more to follow on that. I'm going to stop there right now, Dirk, and thank you again, Congressman Scott, for having me on the call.
Thank you very much, Dr. Hines. And now let's meet Dr. Janet Meamark. Dr. Meamark, welcome to the call.
Hey, thank you so much for having me. First of all, I want to apologize to anybody that was trying to get through to our websites yesterday. So I know that has been some trouble. We became extremely popular very fast, and we're having some trouble with it. So we are definitely have most of it back up today. So I just wanted to hit on some highlights for us. For Cobb and Douglas counties, we have one current mass site that is at the Jim Miller Park location, and you can find the website link on our cobbanddouglaspublichealth.org website. Now, the trouble with that is that there aren't many appointments available. So today, I was really proud of our group. They were able to do over 850 shots today, which is spectacular. But the appointments go extremely fast. I want to warn everybody about that. We will be beginning our Douglas County location. It started in the Douglas Health Department today, and it's on a small scale, and they're ramping it up. And we're in talks with bigger locations to do another mass site over there. So that will ramp up as we build staff and get everything ready. And we anticipate that both of these sites will be able to do close to 1,000 vaccinations per site per day. So we're really looking forward to having that available. And so I just wanted to make sure everybody's aware, but I'm sure Dr. Paxton also would welcome me to say this as well, that we are not the only vaccinators. So definitely, go to the DPH website and the vaccine locator section, and you can find more vaccine providers that are in your area. And so That will increase every week. They're increasing and adding commercial providers to give more access to all of our citizens. So please visit all these locations and please get your shot because it's probably the best thing that we have to beating this pandemic. So thank you.
Great advice, Doctor. Thank you. Moving on, we've got Dr. Sudha Reddy joining us now. Dr. Reddy, welcome.
Good evening, everyone. Thank you, Congressman Scott, for this opportunity, and thank you for the continued relationship we share and your public service. I am the Chief Medical Officer as well as the Emergency Services Physician for Clayton County Fire and EMS, as well as Clayton County Emergency Management. And from that, we, what I will speak to is the amount of thought planning that goes into vaccinations. We have a partnership with District 4 as well as District 3.3, Clayton County, to help coordinate, facilitate, and support so much of these vaccination efforts. We have taken on a lot of work with our public safety, EMS, public police departments, sheriff offices, as well as in partnership with Department of Public Health to cover so many needs and so many high-risk groups. Moving forward, as we look into the future of getting shots in arms and mass vaccination, one of the things that I want to reassure the callers is how much effort and safety goes into these mass vaccination sites. There is a very strict protocol. There is a lot of thought processing and individuals who are working very hard to reach those numbers that Dr. Meamark specifically spoke of. It is a coordination effort. It is a cooperation between many organizations. And as a recipient of the vaccine, from the time you are able to sign up online to this time you receive your second dose, it is a massive public health coordination effort. And with that, though we ask for patience, our goal is to get everyone vaccinated. Within these sites, you will expect to have paperwork and documentation as well as the actual immunization. Please be prepared to wait 15 minutes as well. We ask that you stay within the vicinity, and those areas will be marked clearly to ensure safety after receiving the vaccine. With that, this is, again, a amazing public health intervention, both from the research and the production of the vaccine to the distribution of it to everyone. Within Clayton County, I want to make sure that I let you know that you can go to claytoncountypublichealth.org to register, and there are 3 mass vaccination dates that have now been scheduled. One is January 15th, January 23rd, and January 29th. The first is at Forest Park, and the second 2 will be at the Kathy Truitt Professional Learning Center in Jonesboro. So please visit the website. Please register. The spots will go fast, which is a very good thing. And please get your vaccination at our sites or at other as they become available at other sites as well. This is our best fight against this pandemic and the suffering and the loss of lives. And the more participation we have, the quicker we can prevent and curtail this pandemic that has taken a toll on so many of us. Thank you again.
Thank you very much, Dr. Reddy. And our final expert this evening, Dr. Lynn Paxton. Dr. Paxton, welcome to the call.
Well, thank you very much for inviting me to join you, and also thank you for putting me last, because I get to benefit from what has already been said by everyone before me and not repeat. So all I'm going to say is I 100% agree with what everyone has said before me. And so for Fulton County, just to give you some information, we have currently 3 standing sites, one at our north station, our north operation, and then another one at the Mercedes-Benz Stadium, and another one in the southern part of the county at the Aviation Boulevard, what we call at the Aviation Station. We are seeing large amounts of people, and we are able to process through many large amounts of people at a time. Our goal is currently, last week we did about 4,000 600 total, but we're rapidly ramping up, and we expect that we will be able to see a minimum of 2,000 people a day at each of our sites. At each of our sites very soon. So we're going for a total of at least by January 25th, about 12,000 per week, and we'll be going up from there depending on the availability of vaccines. For Fulton County, we have, as have other counties, experienced, growing pains in terms of huge amounts, many people wanting to access this and overloading our systems. So at the moment, all appointments for this week have been taken, but we expect that we will be opening up our appointment system probably by the end of the week for new appointments. And so again, as Dr. Meamark and others have urged, please keep monitoring our sites and be ready to, make an appointment as they come up. We have basically two ways of making an appointment. Either through our website, and I always encourage people to go to our website for information, at least about where we are with our in our phases. And there's a link that when appointments are available, you can click on it and you can leave your information so that an appointment can be made for you. For those who are unable to use the internet or don't have access to it, we have a call center. And you can call into those centers, and they will take your information and they will schedule an appointment for you when one is available. So we are also increasing our staffing of the call centers and increasing the number of lines, and we hope that very soon it will be able to meet the huge need that is out there. So again, I won't reiterate what everyone else has said because it applies equally well for Fulton. But again, I would urge everyone to, one, be patient as we ramp up, and two, don't forget to keep doing all the things that we know work to prevent transmission, like wearing your mask, washing your hands, keeping your distance, not congregating, because all of us are going to need to continue to do that for the foreseeable future. So I just want to remember to emphasize, let's not leave behind the things that we know that work as we wait for everyone to be vaccinated. So thank you very much for inviting me.
Great advice, Dr. Paxton. Thank you very much. And now it's time to get into the Q&A, but before we jump into that, as a reminder, if you would like to join the Congressman's e-newsletter list, please press *6 on your telephone keypad right now. If you're listening to this on your phone, that feature will take you into an area where you can provide your email and always stay up to date with everything going on with Congressman Scott with his e-news list. So again, that is *6. And our first question this evening, I'd like to direct to Dr. Kelly. And the question comes from Ken, who asks, are the two vaccines the same, or what is the difference?
Thanks for your question. I would say the two vaccines are extremely similar. They have some maybe minor differences in their dose as well as their makeup, but I think that people should not be concerned too much with that, and they should get the vaccine that is available to them. So by and large, I would say they're basically the same with some small differences, and people should get the vaccine that's available. Wonderful. It is, however, recommended that if you get one dose of the first vaccine, that you continue to get the second dose of that same vaccine. Currently, that's the recommendation.
Very good. Actually, since I jumped in on you, I thought you were finished. Just to confirm, you were saying that if you stay with the same vaccine for your second dose. Is that correct, Doctor?
That is the current recommendation, that if you get the Pfizer vaccine first, your second dose should be the Pfizer vaccine.
Thank you very much. Now moving on to our second question. And this one, Dr. Hines. Question is, will people with diabetes or allergies to penicillin or Sufy drugs be able to get vaccinated?
Hey, thank you for that question. Before I answer, I just want to let everyone know, most of us on this call, including myself, we have gotten our vaccinations, and that's critically important for you to hear. I got my second dose last Friday. I'll answer your question. Penicillin allergies is not a contraindication to getting the vaccine, so people should certainly check with your provider, but there should not be a problem with you getting the vaccine if you have a penicillin allergy. The other question that comes with this is, if I have an allergy to eggs, can I get the vaccination? As Dr. Kelly said, these two vaccines right now were not manufactured in eggs at all, so people who have an allergy to eggs can still get this vaccine.
Wonderful. Thank you very much, Doctor. Our next question looks like we could probably go to a number of our experts. The question is, when and where can seniors get the vaccine? So, Dr. Meamark, we'll start with you first.
Okay, great. So, we talked about ramping up our sites for our district for Cobb and Douglas. And so one of the important things that people should know is that we only release the appointments when we know we have the vaccine available. And so that's how our district does it, just to make sure that we don't, waste people's time, that they can get appointments elsewhere. So, we want to go ahead and just do that, and we'll do that probably about once a week. We'll release the appointments. But check your other providers. I just heard yesterday Wellstar is our major provider in our district, and they released 10,000 appointments to vaccinate seniors that are in their network. And so DPH will continue to give vaccines to different providers. So please just keep watching out. If you want to know, go to the DPH Vaccine Locator website, and you can see where vaccines are available in your district. So that should help you out some.
Thank you very much. And next, let's go with you, Dr. Paxton, on the same question.
Well, actually, I think that Dr. Meamark has said it all. In that, the first things first, check with your own provider. It might be that they're registered to provide vaccines, and you can get it through them. Check the various websites, and just keep and we, as does Cobb. Fulton releases our appointments as soon as we have enough vaccine and the logistics to get them out. So just keep checking back.
Very good. And Dr. Reddy, your input, please.
Thank you, Dirk. I would agree. I would support the vigilance of checking resources. I think that we are all working to expand who we can work with to distribute vaccines to seniors, mass vaccinations. Right now, there's currently discussion on involving senior centers and some other ways to distribute. So I think as a individual who is eligible by age, that keep checking, because I think those options will grow.
Very good. And moving on to our next question, we've got what happens if you don't get the second shot in the allotted period of time, and then how are they going to contact me after I get the first shot? So, Dr. Meamark?
So, and Dr. Let's see here. Dr. Kelly can correct me, but my understanding is that if you need to try to get it as close as possible to the time period that you need to get it done. And so for Pfizer, it's 21 days. For Moderna, it's 28 days. So the state of Georgia has asked us not to get it any earlier than 28 or 21 days. But what the ACIP has recommended, though, if you miss it by a few days, you'll be okay. So just go ahead and get that vaccine as soon as possible. I wouldn't try to put it off too long, but try to get your appointment as soon as possible. What was the other question? I apologize.
And then the question is about getting contacted. So how are they going to contact me after I get the first shot?
Yeah, so if you sign up for VSafe, you will get a reminder for that. Otherwise, on your card when you come, it will tell you the date that you received the vaccine and when your next dose is due and which vaccine to get. That is really, really important because we have Pfizer and Moderna right now, and we'll probably another one should be coming down soon. So you have to keep all of these straight. So you just got to really make sure that you get the right vaccine. The second dose, it has to be the same as the first dose.
Very good. Dr. Reddy, do you have anything to add here?
I believe Dr. Meamark did an excellent job.
Okay, you're taking Dr. Paxton's line. Dr. Paxton, anything from you?
No, I don't have anything to add. Thank you.
Okay, very good. So as we move ahead here, just another quick reminder: if you would like to join the Congressman's e-newsletter list, please press *6 on your telephone keypad right now. Again, press *6 to join the Congressman's e-newsletter list. And our next question is for Dr. Kelly. Is it true the Pfizer vaccine is only good for 3 or 4 months, while the Moderna is good for 12 months?
Actually, that's the first time I've heard that. So no, we don't have any information yet about how long the immunity that these vaccines give to people, how long it will last. I will say my opinion in looking at how long immunity appears to last after natural infection and how high the antibody levels get with these vaccines. I would say it's going to be on the order of many months. But we need to continue the clinical trials. We need to continue the follow-up of the participants we have in the clinical trials, and we are doing that. We're going to be following them all for 2 years to see how long that vaccine-induced immunity lasts. But I feel pretty confident that it's going to be very many months. And there is no data on differences in the longevity of the immunity between the 2 current vaccines that we have. So I wouldn't worry about that just yet.
Thank you, Dr. Kelly. Moving on to our next question. And the question is, are there plans to open up more sites for vaccinations? Dr. Paxton.
Yes, there are. We will be, for the moment, we are concentrating on our mass vaccination sites at the 3 sites that I mentioned before. But as more resources and more vaccine are available, we intend to open up more sites. And in addition, we'll be expanding into using our mobile units so that we will be able to go out into the community to get a little closer to people who might want to get vaccinated. But that's all in the future. Thank you.
Thank you, Dr. Paxton. Dr. Meamark.
So we talked about standing up our Douglas County sites, and we will continue to do that. But actually, DPH discussed, and I think in the governor's remarks today, they did discuss adding new mass vaccination sites throughout the state. And so we haven't heard yet where those places will be, but they are working on multiple sites. They feel that that might be the most effective way to do that. So I've heard several people talking about standing up mass vaccination sites. I wouldn't be surprised if you see that coming down soon.
Thank you, Dr. Meamark. And we're talking about the idea of opening up more sites for vaccinations. Dr. Reddy.
Yes, working at a very local level, that is also in the cards. I think when you are looking at reaching as many people as possible, we would also be looking at strategically using mobile vaccination clinics as well to reach as many people in different communities and municipalities as well as partnering with additional partners like, as I mentioned before, senior centers to try to increase distribution points.
Very good. Thank you for your answer. Another question here, and this one, I think Dr. Meamark will address it to you. Leroy wonders, what is the recommendations for parents in Cobb County to return students back to school?
Yeah, so this is something I talked about today, and so we have just some extremely high case rates that are happening right now in our district, as well as hospitalization. So our regional area hospital, Kennestone, has the highest number of COVID admissions than anybody in the state right now. So we are really having a lot of burden of the COVID-19 in our district. And so when we look at schools, I know schools have tried very hard to do everything they possibly could to make the schools as safe as possible. But because community rates are so high, everybody has to kind of look at their own situations. And so when you look at different schools, like I have 2 children that are in the Cobb County School District. I looked at my own life and situation, and I looked at how many children were in the schools and how well they were able to do social distancing, things like that. I'm grateful that they all wear masks, but it's something that everybody has to decide. But if you can keep your children home to do virtual learning right right now, because the cases are so high, I would take all of these things into consideration on whether you decide to have them face-to-face or virtual right now. If you have the possibility of doing virtual schooling and your schools have a lot of kids and are not able to space them out really well, then you kind of have to put all of these things together. So and talk to your school at that point. So I definitely say everybody look at your situations case by case and school by school, because every school is very different and each of you will be affected differently.
Thank you very much, Dr. Meamark. Our next question looks like a good question for Dr. Paxton. It has to do with airline employees. And the question is, will airline employees be grouped into the 1A category? We are frontline folks.
That is a question that is a little bit above my pay grade. I am not sure about. We're still working with DPH and the governor's office, as I understand, to get better definitions of who exactly is considered an essential worker. I do know for certain that air traffic controllers are considered to be essential workers, because if there are many of them that are put out of commission by COVID, then basically our entire air system would collapse. But I cannot answer specifically about actual airline employees. So what I would recommend is to continue, as I mentioned before, about monitoring our website, because as we get closer to the 1B phase, which is the phase in which we will be vaccinating essential workers, we will be putting up on our website who qualifies as an essential worker.
Great direction and insight, Dr. Paxton. Thank you very much. And our next question, I think we've kind of looked at this, but let's go ahead and ask it again of Dr. Kelly. How long is the shot effective after getting the vaccine and the booster?
Yes, that is a similar question to how long the immune response lasts. The shorter answer is we don't know as of yet, but based on everything we've seen so far, my best guess is that it will be many months. But we are still following the participants in the clinical trials. We'll be following them up for 2 years, but we just don't know yet how long the vaccine-induced immunity will last. I think it's looking pretty good. I think we have reason to be hopeful that it will last for many months at the minimum.
Perfect. Thank you very much, Dr. Kelly. So our next question looks like a good question for Dr. Reddy. Keisha is wondering, how does it affect someone like her who's 45 years old, has a pacemaker, and congestive heart failure? Should she get the vaccine?
That is an unequivocal yes. That is a, Keisha, I would highly implore you to get the vaccine. You have conditions that have been shown to put you in an extremely high-risk category for the short-term ability of your body to manage COVID infection. You have a higher likelihood of having a more protracted as well as complicated course and an increased risk for very much the worst case outcomes. So with that, you have significant risk factors, so please do get the vaccine. I know that in terms of phasing, right now we are moving as quickly as we can to get individuals such as yourself who are equally at high risk, who do not meet the 65-year-old category but have significant comorbid diseases. So again, as soon as we are able to and have the green light to transition, we will be doing that and targeting individuals such as yourself who would be at highest benefit from this vaccine.
Thank you very much, Dr. Reddy. And our next question is from Brooke. She says her mother is currently at stage 4 cancer patient and wants to know, can she currently get the vaccine and anyone in her household, since they live with her, get the vaccine? So this is kind of a question. I'll start with Dr. Kelly, and then we'll bounce to whoever really has the answer. Dr. Kelly?
Yeah, absolutely. So this is not a live vaccine. Both the Pfizer and the Moderna vaccines are not live vaccines, and so we don't really worry as much about safety in folks who may have a suppressed immune system. So I would say yes, absolutely. You should go ahead and get vaccinated even if you have underlying conditions such as advanced cancer. We don't believe that there will be any increased risk of side effects or any harm that occurs to folks, even though those people were excluded from the clinical trial. So we don't have a lot of scientific data. We also don't know what the immune response will be like in people who are immunosuppressed because of cancer or chemotherapy or autoimmune disease or some other illness that requires them to take medications that suppress their immune system. But I think we feel fairly confident that these vaccines will be safe in those folks and that they should go ahead and get them. And time will tell, and scientists will tell us, and the data will tell us as the clinical trials continue what the immune response looks like in folks with immune deficiencies underlying.
Thank you.
Hi,
Dr.
this
Kelly.
is
anyone else?
Yeah, this is Dr. Hines. My other role is I am a gynecologic oncologist, and I will affirm 100% what Dr. Kelly just said. The big professional societies that take care of people with cancer in this country have affirmed, yes, those patients were not included in the clinical trials, but there does not appear to be a contraindication to those patients with malignancies, even those undergoing chemotherapy or radiation therapy or targeted therapy, but we always suggest and recommend that patients confirm that with their oncologist.
Thank you very much, Dr. Hines, for adding that additional information for us. It is very good to have. And now we've got a question from Peggy, and it really has to do with something on a lot of people's minds. So, will folks without health insurance be able to access the vaccine? And Dr. Meamark, your thoughts?
Yeah, so if you come to any of our sites, if you have insurance and want to provide it to us, we do ask for that to copy it as for an administrative fee, but the vaccine is not charged, and you will not get any fee that's charged to you. But if you have no insurance, we welcome you to come, please. Any of our sites, and actually, I don't think anybody can stop you from getting a vaccine because you don't have insurance. So I know Dr. Paxton will say this too, but you are welcome at any of our public health sites for sure.
Thank you very much, Doctor. Moving on here, it looks like a good question for Dr. Hines. This one was submitted by Janet. Given the speed in which the vaccine was created, do you have any information on the impact the vaccines may have on the reproductive system of those individuals who are of childbearing or child-producing age?
Yes, thank you. That's an awesome question, and one I can answer, and I'm sure Dr. Kelly may want to chime in. As she mentioned, Dr. Kelly mentioned, these mRNA viruses, when they are injected into your arm, they go into the muscle cells. And the mRNA does not, let me repeat that, does not go into the nucleus of your cells in your body. So it doesn't interact with your own genetic material. The mRNA is designed to produce that spike protein, and then it quickly goes away. So it does not go into the nuclear material of you as a person. And if you're of childbearing or pregnant, there is no contraindication to you getting the vaccine.
Thank you very much, Dr. Hines. So our next question, how soon can you get a COVID-19 vaccination after having contracted COVID-19? Dr. Kelly?
The recommendations actually are that you can get the COVID vaccine after you've recovered. The immune response to natural COVID infection is highly variable, and there's some possibility that some people may even need that vaccine in order to protect them from future infections. That said, recurrent infection is extremely rare as far as we know right now, and there's not really a rush to get the vaccine after you've had COVID infection. So if you want to wait 3 months or so, that's also okay. And so it's really up to the individual. They can talk that over with their family, with their healthcare provider, and make a plan. But either way is acceptable, either after you recover or waiting a few months.
Perfect. Thank you very much, Dr. Kelly. And as a reminder to everyone on this call listening in, if you would like to join Congressman Scott's e-newsletter list, please press *6 now on your telephone keypad. Again, keep up to date with everything going on with Congressman Scott in his office by pressing *6 now on your telephone keypad. Now, our next question looks like we've got one that could form a pretty good discussion here. And so we'll go here with the question. And it's wondering if you can discuss how people can get the vaccine in their respective counties. In particular, let's go ahead and include contact information, website, phone numbers, etc. So we'll start off here with Dr. Hines.
That's probably a better question for the county public health officials to answer. Except that I will say, continue to monitor the different websites and the phone calls that will be distributed to you this evening.
Okay. Dr. Hines, I'll take that. This is Dr. Meamark.
Yes, ma'am. Go right ahead.
Okay, so I heard from WellStar today that if you are a WellStar patient over 65, that you should receive a message through my chart for that. For our two counties, you can go for Cobb. Keep watching our website. For Cobb, it's www.cdphcovidvaccineappointments.org. That's the actual registration site. Right now, we do not have appointments, but they'll be released within a couple of days for Saturday. In Douglas, it's www.douglascovidvax.org, and that's the actual registration site, and that will grow as we continue to grow that site.
Thank you very much, Doctor, for saving me on that one. We'll move on to Dr. Reddy.
Hi. So for Clayton County, it's claytoncountypublichealth.org, and there is a area to, if you scroll down, where you can register for vaccinations, and I would continue to check that. And then the same sites for Henry as well as Fayette County. Go to the local health department site, and you will be able to register at those individual sites.
Thank you, Dr. Reddy. Dr. Paxton.
For Fulton County, the best thing to do is to go to our Fulton County Board of Health site, and that it would be www.fultoncountyga.gov. That is for the general Fulton County Board of Health site. And once there on the landing page, you'll see a series of, it'll direct you to how to get all the information about COVID-19 and how to get a test, including the email addresses that can be used if you have further questions, and the number for our call center. Thank you.
Thank you very much, Dr. Paxton. Looks like we have time for one more question. And this one I will bring Dr. Hines on, and I will ask it. It's sent in by Carla. How can we ensure the African-American community that the shot is safe?
Sure, that's a great question. Thank you, Carla. It is safe. Well, first of all, I trust the science, and I got my 2 injections. My last injection was this past Friday. So it's safe, and what we need to do is to message to the African-American community that has a decent amount of hesitancy that this was not rushed. As Dr. Kelly had mentioned earlier, the process that this went through had the benefit of years and years and years of studying other coronaviruses. We had good support for this financially. The regulatory issues were not shortcut. This is a safe vaccine that's really going to help a particular community that is already suffering disproportionately. And we've got to get the right people in front of community members to hear that trusted information.
Thank you very much, Dr. Hines. And Congressman Scott, I understand you have a question, sir.
Yes, I do. I think it's very important to hear our panelists share with us this issue and terrible news that there is an even stronger vein of COVID-19 coming towards us. Can you all give us some explanation of that and what it is and what impact this is going to have going forward? This new and tougher strain, I understand it's in various parts of the world now and could be drifting over here, or is it here yet? Can you give us an update on this dangerous new strain of COVID-19 that we have to deal with? Thank you.
Dr. Kelly?
Sure. So I think you're referring to what has been in the news as the UK variant or maybe the South Africa variant. In the United Kingdom, this variant is highly transmissible and is leading to huge surges that they're seeing in cases. And so it is worrisome. But there is some good news in that it appears that the vaccines are expected to be just as effective against these variant viruses as they are against the standard viruses. Vaccines or viruses mutate. It's what they do. And when there's a lot of replicating going on, as there currently is in the current surges that we're experiencing, we're going to see mutations in the virus. And that's what happened. And that UK variant does appear to be more transmissible, but it does not appear to be associated with an increased risk of death or hospitalization or with a reduced efficacy of the vaccines as far as we can tell. And so that's good news. So we need to be concerned about this, but not overly worried at this point in time.
Thank you, Dr. Kelly. Anyone else here on the panel?
Yeah, if you don't mind, this is Dr. Meamark. I just wanted to add one thing about that. So we have evidence that we have found this new variant in the state of Georgia. And so just remember that we are already at very high transmission levels. And so this kind of just adds one more layer of concern for us. And I know we spent a lot of time talking about the vaccine, and we're very excited that we have the vaccine and there is some hope on the horizon. But we must continue to do these public health measures to slow this down too. So it has to take both of these things because, like I had mentioned, our hospitals are extremely busy. So you have to wear your mask and, you know, to keep your distance from folks. And I'm asking folks to please try not to go out unnecessarily at this time. If you remember when we first started this pandemic that we were teleworking and trying our best not to get too have too much interaction with folks and get too close. And I really highly recommend that for this time because the cases are very high throughout the entire state.
Thank you very much, Doctor. Anyone else?
Sure. Yes, Dirk, I would like to restate what Dr. Meamark has said. Being in the business of EMS, the landscape right now with our numbers are very dangerous to all of us, and to continue to practice these measures of social distancing and mask wearing and not being in large gatherings is fundamental because our resources are extremely strained right now. The emergency rooms, as well as the capacity of staff and the critical nature of what our bed availability is extremely concerning. And so these are things that individuals can do to contribute to keeping the numbers as low as possible.
And anything further from anyone else on the panel? Hearing nothing further, as I mentioned, we're going to start to wrap up the call. Congressman, do you have any closing remarks you'd like to share with us?
Yes. First of all, thank you. Thanks to all of the questions. They were most informative. I hope this has helped people. I want to thank Dr. Colleen Kelly, Dr. Jeffrey Hines, Dr. Janet Meamark, Dr. Lynn Paxton, and well as my good dear friend, Dr. Sufy Reddy, who's been with us from the very beginning. I also want to remember, please, wear your mask. That is the one sure way of not getting it. Keep distance. Don't go out. We can win this battle. And the other thing, please, call me. Call David Scott at 770-210-3600. 5073. We've given you all a lot of information, but the biggest piece of this information is to have this phone number. My staff with Chandra Harris, who are the district director, working with all of the people you've heard. We're also working to figure out the best way and the quickest way for us to mobilize. We've got to attack this virus. The Lord has given us this weapon, this vaccine, and I can't tell you how disappointed I am every time I read of how we're not getting it out. We got 30 and 40 million doses in warehouses. How long can that last? So I'm up here in Washington now trying to raise as much sand to turn loose this. But then we have to have the infrastructure in place. So we're going to be working with it to be able to mobilize. That's the answer. That's how we got the testing done. That's how we save lives. So many people don't have connections with a doctor, with hospitals, and that's why we have to get it out into the communities. So we're putting that together, and as you heard from our Cobb and Douglas and Fulton people and all of our county public healths, they aren't waiting. They're still trying to get it out. So all I can say is call our number, and we will help you get it there. And as I say again, this is a dual process. And then we got this other strain coming, and I was so glad to hear the news that what we got in this vaccine will kill this stronger strain too. So the good Lord has given us this blessing of this vaccine, but we are not doing everything we need to do here in Washington to get that out. And I'm working feverishly to get that done. But in the meantime, call me. If there are people out there that can get all the other numbers, you call me and my staff at 770-210-5073 so we can get you to some of the people you heard talking who can help get you that vaccination. We'll get you to them. God bless you all. Thank you. And we're going to beat this virus. God is on our side. But he is telling us that we got to go to act and get this virus vaccine into the arms. As I told the speaker and I told folks on the floor, what does it mean for God to give us the vaccine and we're not doing the vaccinations? I'm sorry I'm preaching here, folks, but sometimes you have to preach. I always call it my Ezekiel instinct. When God told Ezekiel, and Ezekiel went to ask him, can these bones in the dry valley live? Ezekiel said, I don't know, Lord. Or the Lord told Ezekiel, yes, we can live, but you got to do something, Ezekiel. Preach to these bones. Get them out. That's what we're going to do. God bless you all, and thank you.
Thank you, Representative Scott, and thank you to each of our speakers for the important information you've shared with us this evening. Now, again, if you'd like to reach Congressman Scott's office with any questions, or you can follow him online for important updates. The phone number to dial, 770-210-5073. The Congressman's website, davidscott.house.gov. You can also find him on Facebook, Twitter, and Instagram with the handle @RepDavidScott. Thank you again to everyone who took the time to join us for our telephone town hall. We hope you stay healthy and safe and have a wonderful evening. Good night, all.